So just want to tell you a little bit about our abstract that we submitted about the NHS England National Patient Safety Improvement Programme. So this was a national programme rolled out throughout the NHS on the back of our 20-site demonstration programme, which I'll be talking about on the programme at the 6th ITS. Essentially, we had 20 very diverse sites up and down the country in the United Kingdom, and we asked them to implement 18 different interventions grouped around quality, safety, and organisational efficiency and effectiveness. But we also wanted to try and capture how staff made those changes. So we wanted to try and capture what worked, what didn't work, and we interviewed and collected data from over 1,500 staff. And then clearly we want to see what impact that had on patients. And so we collected patient-level data using the Global Tracheostomy Collaborative Database in about 2,400 patients, 2,405, I think, to be correct. When we finished that project, we went to NHS England, which is the National Public Health Service in the United Kingdom, and we said, look, we've done this project now in 10% of all the acute sites that you look after. And based on the impact that we had from this detailed sort of 20-site snapshot, we were able to estimate that we would save a huge amount of money if we rolled this out to the wider NHS. So about £275 million per year. And that's assuming that all the other sites did the same sort of things that we'd achieved in the programme. We estimated that we could save up to 170 lives through the safety work because we'd seen a 55% reduction in the severity of harm. And there's lots of other process metrics, importantly reduction in anxiety amongst patients, that we thought were really helpful. So COVID came along and we very rapidly retasked the national rollout of this programme into the COVID-19 Safer Tracheostomy Care Response. This was developed ridiculously quickly by the Academic Health Sciences Network, and you'll hear some more about this from Phil Duncan, one of our keynote speakers at the symposium. We were able to condense the specific improvement work from our tracheostomy programme into COVID-specific work, and then roll that out by developing a resource pack. We focused on standardising daily bundles of care. We focused on the bedhead signs paired with the emergency algorithms. And then we made sure that people had a standardised bedside checklist and bedside equipment to make sure that patients would get the best care they could wherever they were cared for during the pandemic. The Academic Health Sciences Network is a system of 15 different groups throughout NHS England that work together to spread these initiatives around the country. And this was all based on a lot of the data that you hear about at the symposium, where we collected best practice in the UK and from around the world. And within 3 months, we found that nearly 90% of sites had adopted some of those key interventions. There's 192 acute sites. All 3 interventions were adopted by 80% of sites after 3 months. And that rose by the end of the 4th quarter, so after 3 quarters of doing this work, to 91% of sites had adopted all interventions, and 93% of all the sites in NHS England had adopted all the elements of the daily care bundle. And this work is testament to the hard work and dedication of all the teams at the Academic Health Sciences Network and throughout the patient safety collaboratives of NHS England in taking this work and really rolling it out to the bedside. So I'm really grateful that we've seen that exemplary quality improvement programme rolled out into the NHS. We don't know much about the impact because we didn't have time to set up detailed databases, but we're working on extrapolating some of that work now. Thank you for listening.